While most women have heard of Kegels, the truth is a lot of women don't know how to do a Kegel properly. Kegel describes a conscious contraction of the pelvic floor muscles. Doing Kegels during pregnancy is helpful to tone the pelvic floor muscles to help with labor, and it's also a good time to learn how to do Kegels properly for postpartum when you're going to need to learn how to re-strengthen the pelvic floor. Doing Kegels post-pregnancy or post-delivery is helpful to rebuild the strength of the pelvic floor, provide support again for the pelvic organs, the bladder, the rectum, and the uterus, and also to help maintain or regain control of the bowel and the bladder. Doing Kegels properly can be a challenge. You need to have both the posterior pelvic floor muscles, the ones that control the bowel, and the anterior pelvic floor muscles, the ones that control the bladder, contracting together. The best place to start is laying on your back with your knees bent and your feet flat on the bed. An image that you can think of is the idea of holding gas in and stopping the flow of urine at the same time. Or you can think of using the anus and the vagina to pick up beans and pull them gently inside. You want to use an exhale breath to help engage the pelvic floor and do your contraction, and that way you won't hold your breath. For a Kegel, you want to try to hold the contraction for 10 seconds, and then you would release the muscles for 5 seconds and repeat that 10 times. The second part of Kegels that you want to be able to do is a quick Kegel, where you contract for 1 second and you release for 2 seconds, aiming to repeat that 30 times. A proper Kegel will not involve contraction of the inner thigh muscles, the buttock muscles. It won't involve breath holding or bracing of the core muscles. Once you've learned how to do a Kegel laying down, you can progress to doing Kegels sitting and standing. Pelvic floor therapy can ensure you're doing Kegels properly, either via an internal examination of the pelvic floor muscles or an external examination, and also checking to see if you're using the right muscles correctly or if you're overusing other muscles. To learn more about pelvic floor physio, you can visit our website at www.trelawneyphysio.com.